Good morning, everyone. I apologise for the slight delay in starting. A few technical problems at my end, which I take full responsibility for. So thank you for your patience. Thank you for waiting in the room for me to sort those out and get started. We will make sure we finish as quickly as possible within the half-an-hour limit, so you don't end up missing anything else that you might have planned in to drop into. If you tuned into the keynote at the start of the day, you will already know me. If not, my name's Chris Lawlor. I'm from the General Medical Council, and I'm one of our regional liaison advisors at the General Medical Council. And I will talk a bit more about my role as we go through the slides. We've got the chat function here, so if you've got any questions as we go through, please do drop the questions in there. If there are any issues with sound or video, etc., just let me know in the chat box there, and I will keep an eye on it. Hopefully you are all thinking about a future career in medicine and you are not at medical school yet, so you're thinking about the possibility of going to medical school. And I'm just going to talk you through the GMC's role in that and how we might touch base with you in your future career, and we'll look at some of the standards that you need to be aware of, some that you might find useful looking at in the next few months and years, and then we'll just look at a few case studies, and I'll sort of ask a few questions, and we'll use the chat function for you to sort of reply and see what we would do in different situations. Ooh, that's not what I wanted to do. Apologies, again, just having some technical problems. So unfortunately, it's. Can people still hear me? I'm not sure if my system's crashing.
Yeah, Chris, we can hear you, but your screen share appears to have stopped.
Yeah, I'm just now. It's now telling me that I'm not responding, so I'm just waiting for the system to catch up, hopefully.
Thanks so much. I think the next session here is only at 11:40, so we can go all the way up to there if you need to.
Yep, no problem. I do apologise, everyone. It's not letting me reply to any of the chat. it's just saying not responding, so I'm just trying to play around with a few things.
Hi, whoever just asked the question about the personal statement masterclass, no, that should still be at 11:40 as scheduled.
So hopefully I'm back in the session. Can everyone hear me now? Can everyone see my screen? Someone?
Yep, all fine now. Thanks, Chris.
Great. So very conscious of time, so not going to go through all of the slides in as much detail as I would like to do so, but I will be around in one of the booths all afternoon. So if we don't cover anything that you would like to discuss in more detail, please do drop into the booth and we can talk through sort of things that we might not get chance to talk about in the next 12 minutes. Very conscious of taking other people's time up. So this hashtag that we are introducing, it is something that's widely used within the NHS now, and it was actually a hashtag that's was created by a doctor. And it's all about the importance of introducing yourselves to patients, to colleagues, to people who you're working with. And that becomes vitally important once you start at medical school. Then you will start going on placements, you will be meeting doctors, and it's important that for some of you, you don't get confused with maybe fully qualified doctors. It's important that people know what your level is, what your role is, what your competence are. So introducing yourself is vitally important at all stages of your career. And as Isabel said it in the chat, it was created by a Dr. Kate Granger. And unfortunately, Dr. Granger was a practicing doctor, and she was diagnosed with cancer. So Dr. Granger became a patient. Then she was admitted to hospital, and she was being treated by lots of doctors, nurses, other medical professionals. And it really struck Dr. Granger that these doctors, these medical professionals were coming and treating her, and a lot of the time they weren't introducing themselves. They weren't taking the time to say who they were, what their role was, until one day the porter came to wheel Dr. Granger from one ward to another, and the porter introduced themselves and said, "Hello, my name is, and I'm just going to wheel your bed along the corridor to the next ward." And that really struck Dr. Granger. So this is something that we encourage for all medical students and doctors to always bear this in mind as you progress through your career. If you remember nothing from today's GMC session, just remember the importance of introducing yourselves. So I won't go too much into my role. If you join medical school in the Northwest, I work in the Northwest. You can see me on the map there. I come and deliver sessions at all the medical schools across the Northwest, but I have colleagues around the UK who visit medical schools on a regular basis, and hopefully you will get a chance to meet them in your future careers. This was going to be what we would cover today, but we've got 10 minutes, so we probably won't do this snapshot of today. We'll just flick through some slides and I'll leave it open to you to ask questions as we go. So just like to show this slide, and some of you may already be aware of this and your interaction with the GMC and your potential career as a doctor moving forward. So this just shows you that the length of time you will be in training and education, and for that period of time the GMC will be very involved in that, and you should have a lot of interaction with the GMC. Oh, so a question there from Isabel. I'll come back to that in a second. I'll just talk through this slide and then we'll talk about Isabel's question. If anyone else can see that question, do feel free to put your answers in there, and then I will share my opinion in a second. So this slide, I think, just nicely demonstrates the career path that you are likely to take as potential doctors. So being at medical school for 4 to 6 years, you'll have a lot of interaction with the GMC. When you then gain your provisional registration, again, the GMC will be heavily involved in that registration process. And then for the life that you are training as a doctor, the GMC will be, monitoring your progress. People like myself will be coming out and delivering sessions to you throughout that training career, and you should have lots of interaction with the GMC throughout your career, hopefully. So we'll go on to Isabel's question. I think it's probably more useful to look at questions than try and flick through slides as quickly as possible. So Isabel's question, if you've not seen it, is if you had to pick your top 5 key skills for a doctor, in your opinion, what 5 skills would you choose? And then Amy's replied, interpersonal and communication skills, speaking to patients and their families, working in a team. So lots of communication. And then Catherine said, oh, people have started to join already. So if Isabel, I'm happy to give my view on Isabel's question, but I would agree with what Amy has said there, and particularly from a GMC perspective, a lot of the guidance and a lot of the standards that we put in place for doctors are absolutely that interpersonal communication skills, and that links into a lot of the complaints that we receive about the GMC, that they're not often about doctors' performance, because you all will train to a very high standard, and you will all have the knowledge and skills from a practical point of view. The skills that we talk about in terms of separating the really good doctors are those communication and interpersonal skills. And when we speak to patients, that's the feedback that we receive, that what makes a patient experience be as good as it can be is having a doctor, a nurse, other medical professionals who have those good interpersonal skills and are able to communicate in a good way. And then George has said empathetic, problem solving, communication, teamwork, resilience. Yep, I would agree with all of those. And I think the key theme running through the answers there are the empathy, communication, teamwork being absolutely key, because you will all work in large teams with people of different abilities, different backgrounds, different ways of working, and being resilient and being able to adapt in the teams that you are working in is absolutely key. We'll skip through some of these slides. We've seen this if you did the keynote. Lots of standards available, and this is where I'd talk about the standards linking into a lot of the points that you are raising there. So if you have a look at good medical practice, a lot of one of the key domains of good medical practice is actually team working. So that links into a number of the points that you've raised there. But if you go and read any of those pieces of guidance, they are not telling a doctor how to treat a patient, how to diagnose a patient. I am not a doctor. I do not have those skills. But what I can talk about with potential doctors or current doctors are how to develop those communication and interpersonal skills and interpret the guidance in a way that is going to improve the patient experience, hopefully. And this is actually the first paragraph from Good Medical Practice. I think this is always an interesting one to read because, again, I think it fits with probably the question there from Isabel. And actually, when you read this, I think it's, a lot of common sense, really. I think, anybody would expect that doctors make the care of their patients the first concern, that they are competent, keep knowledge and skills up to date, and then I think the key sort of last line at the bottom, that they are honest and trustworthy and act with integrity. Just looking at Isabel's question there, how do you think doctors can communicate well and improve patient experience when they are so time limited? Really good question again, Isabel. I think that's something that I hear regularly from doctors, that you're meeting with patients for 5-10 minutes trying to get through a lot of detail. And I think actually this slide probably answers it for me. And it's about being honest and acting with integrity and developing those relationships. So, using language that your patient will understand. So that's all about the professional judgment of a doctor and getting to know your patient and what their level of understanding is likely to be, not using too much jargon because that can confuse patients. It can leave them not understanding what's been said, and maybe they leave a consultation and they're not actually sure what the diagnosis or the treatment plan that's put in place might be. But I think it's understanding that you are so limited for time, but making the best use of that time by explaining things as clearly as possible, making sure that the patient has time to ask questions, if needed, booking follow-up appointments, asking for support from colleagues if you're in a difficult situation. And there's lots of different ways that the patient experience can be improved, but I would just point to this slide that if a doctor, is honest and is trustworthy and is acting with integrity and builds up that good relationship with a patient, then that should in turn lead to the patient having a positive experience, hopefully. So if you are thinking about going to medical school in the near future, this is a good piece of guidance for you to be aware of. You can find all GMC guidance on our website, so you can go and find this piece of guidance and just have a read of it and familiarize yourself with achieving good medical practice for medical students. And this is really preparing you for good medical practice once you have finish medical school. So if you're unsure about the expectations, the standards that we expect of doctors, then this is a good starting point, something for you to go and have a read of. Okay, so couple of questions there. First one from Simran: do you need to be a doctor to work in the General Medical Council? Absolutely not. I think there are about 1,500 members of staff at the GMC approximately. I would suggest less than 10% of those would be qualified doctors. We do obviously have some doctors, and some of the roles we have to be filled by doctors because of the work that we do, but there's probably maybe 5 to 10 doctors working at the General Medical Council in different types of roles. So we do employ doctors, and doctors do want to work for the GMC, but on the whole, lots of the work is sort of admin type process work and doesn't need to be, you don't need a medical qualification for that. And then question from George, a bit conscious of time as we're supposed to be wrapping up now. Some advice about communication, especially breaking down bad news to patients and their family. So there's some really useful guidance that we've got on our website, George, called End of Life Care. And that talks about how how you should be approaching those conversations. And again, it's about finding the right environment, about doing it, having these conversations at the right time. So end of life care is a really good sort of piece of guidance to look at, because our end of life care guidance looks at, treating a patient who's potentially going to die in 12 months. So it's a long period of time. So end of life care isn't sort of, somebody who's likely to pass away in the immediate future. It's preparing those conversations as far out as possible, and the way that you have those conversations, whether it be with the patient or patients' families, etc.